What is patient abandonment? I'm Erin Jackson with Jackson LLP Healthcare Lawyers. This is a question that comes up frequently, especially when a provider is trying to navigate a non-solicitation clause in their employment contract when they're moving on to a new practice. Does a failure to provide info to their patients about where they're going constitute patient abandonment? Patient abandonment generally means that a healthcare provider has failed to tend to the needs of their patient without giving them adequate notice or an opportunity for ongoing care. That does not mean that the provider themselves has to keep treating the patient. It's all about notice and information here. So one of the best ways to understand patient abandonment is through some examples of what it is and what it isn't. So a few examples of what might constitute patient abandonment. Keeping in mind the details and the factual circumstances of each case are what will ultimately be the deciding factor. So a provider who fails to provide follow-up care for a patient after performing surgery on them, doesn't check in and doesn't return phone calls, that might be considered patient abandonment. A provider moves and doesn't bother to tell any of their patients, and when their patients go to make an appointment with them, learn that not only is no one else at the practice taking patients, but their provider's long gone. That could constitute patient abandonment. Failing to provide an adequate bridge to a new provider if a provider's insurance changes or their payment scheme changes. For example, if a provider decides to go to a cash-only or concierge model and they previously accepted Medicare, Medicaid, or commercial third-party payers, then just telling all their patients next time they come in or not following up with them that, hey, I'm cash-only now, that could constitute patient abandonment because it fails to provide those patients with an opportunity to establish a new patient relationship with a provider where they can obtain continuity of care. So essentially, it's about not dumping your patients in a situation where they cannot continue to receive follow-up care and they don't have clear instructions or an idea of where to obtain the next step. Where do they go next for care? This is why major hospital systems are in the habit of sending letters to patients when their primary care doctor leaves the system or moves to a different location or begins accepting different insurance plans. It's all an attempt to ensure patients are informed about whether they continue to have access to that provider. And frequently those letters will automatically assign patients to a new doctor. Here's your new primary care doctor. We encourage you to make an appointment with them and feel free to change them or reach out if you have any questions. This is all because they want to ensure that there is no break in the continuity of that patient's health care. Now, what sounds like patient abandonment but actually isn't? Well, maybe a provider is terminating care with a patient who is abusive or is problematic or causes some major issue at the practice when the patient is there. Perhaps it's a patient who refuses to pay any balances, work with any financial aid team, or provide necessary documentation despite multiple warnings and multiple discussions to try to effectuate some sort of financial aid assistance. Perhaps it's a patient whose needs now fall outside the provider's scope of practice, and the provider can no longer offer skilled care or care within their licensure to that patient. Lastly, perhaps the provider is moving away and sends the patients a letter documenting that they're leaving and that they are welcome to continue their care with another provider at the practice. Now, this sometimes is where providers get hung up because it might seem like you're the only person in the area who offers this particular expertise, or you're so familiar with a particular patient situation. This is especially true for psychiatrists and mental health care providers. You're so familiar with that patient that really it doesn't seem prudent to pass their care on to another provider. If you provide the patient with notice and choices and you have open discussions with them, that likely is not going to constitute patient abandonment. When analyzing these legal issues, we look at each provider's Practice Act and ethical obligations, and we also look at best practices, including what your practice policies dictate to transition a patient from one provider to another, and the details about where you'll be going and whether it would violate your contract for you to actively let patients know where they can find you. If you have questions about this, which you surely do, feel free to call our office and schedule a consultation with one of our attorneys. For more tips on staying compliant, subscribe to our YouTube channel.